Hi, and welcome to another patient education webinar from Total Health Conferencing. Today, I'm really excited to be joined by my panelists. I'll go through a short introduction of each one of them and then ask Deepa Lalla to give us a short presentation before we get into the information designed to help guide therapeutic decision-making for providers, for patients, and for caregivers alike. So I'm Sarah Louden from Total Health Conferencing, and I'm joined tonight with Deepa Lalla, Vice President of Medical Affairs for Puma Biotechnology, Dr. Irene Kang, Assistant Professor of Clinical Medicine from the University of Southern California, and our wonderful patient, Valerie, who's going to share her story and share a little bit about her journey on what it is we're learning about tonight. So Deepa, by the way, I'd like to just be able to call you all by first name. I know that, there's a lot of professional things that all of us do, but today it's really just about having open dialogue with each other so that we can empower each other to make great decisions. So Deepa, I'd like to ask you to kind of set the stage. I know you've got about 20 minutes for us called Reducing the Risk of Recurrence with Nerlynx. And this is an opportunity for us to kind of get into the information that we'll use as a catalyst for the rest of the conversation tonight with Dr. Kang and Valerie. And so Deepa, when you're ready, we're ready to move on.
Perfect. Thank you so much, Sarah, and it's a pleasure to be here, especially with both Valerie and Irene. So thank you very much for this opportunity. Hello, everyone. So today we want to just go over HER2-positive early-stage breast cancer and talk about the risk of recurrence, and that is a cancer that might come back after initial treatment, what early-stage breast cancer treatment looks like, and then spend some time on treatment with Nerlynx. It's really important that if you have any questions about your own medical care or treatment, please do consult your doctor. A brief overview of Nerlynx. Nerlynx is a prescription medicine used alone to treat adults with early-stage human epithelial growth factor receptor, or HER2, positive breast cancer, and who have previously been treated with trastuzumab-based therapy. And you may know trastuzumab as Herceptin. It is not known if Nerlynx is safe and effective in children. So just talking about what the risk of recurrence is in patients who have HER2-positive early-stage breast cancer. We'll just discuss really quickly what it means to be diagnosed with early-stage HER2-positive disease and the risk of recurrence. So let's talk about how common breast cancer and then HER2-positive breast cancer is in the United States. I think many of us have seen this number before, that 1 in 8 women in the US will develop invasive breast cancer at some point in their life. About 15 to 20% of these women will have a cancer that overexpresses HER2, also known as HER2-positive breast cancer. HER2 breast cancer is considered aggressive, and this cancer can return after initial treatment in 1 in 4 women after they have received trastuzumab-based treatment. So what's the biology of HER2? All of us have HER2 receptors on healthy cells, and these receptors normally send signals telling cells how to grow, when to grow. In HER2-positive breast cancer, there are way more than normal of these cells, and these cells then send messages to the cells around them, telling them to grow and divide in an uncontrollable fashion. This is what makes HER2-positive breast cancer especially aggressive. I wanted to quickly talk to, what is the fear of recurrence in patients who have been treated with breast cancer? According to a survey done by breastcancer.org of 307 women who had HER2-positive early breast cancer, over 90% of them were concerned about the possibility of the cancer coming back. And of these, more than 3 in 4, or 78%, said that of all the worries, the fear of recurrence is the greatest fear or greatest concern. And we know from many other things that fear can impact your life. And so the fear of recurrence can, of course, significantly impact a patient's life as well. So I just want to quickly go through now some treatment options that can help reduce the risk of recurrence in HER2-positive early breast cancer. So this is what the normal treatment paradigm might look like, and it's anchored by surgery. Sometimes the patient may receive treatment before surgery, also known as neoadjuvant therapy. And the goal of this step is to shrink the tumor before the surgery and then see how responsive or how did the tumor react to the treatment that was given. The patient would then undergo surgery to remove as much of the tumor or the cancer as possible, and then also to check and see if the cancer has spread to the nearby lymph node. After surgery, the treatment is called adjuvant therapy, and the goal of this is to kill any remaining cancer cells that either the neoadjuvant therapy or the surgery may have missed. And then the goal, of course, is to reduce the risk of the cancer coming back. And then finally, extended adjuvant treatment, if indicated, is used to kill any other remaining cancer cells, especially those that are slow growing and may come back over time, and to even further reduce the risk of recurrence. So Nerlynx prevents recurrence from inside the cell. There are molecules such as monoclonal antibodies, and that's a mouthful, that work by interfering with the receptors outside the cell. And the receptors that are outside the cell also send signals inside the cell. And Nerlynx interacts with multiple cell family receptors inside the cell to block growth pathways, of which there are multiple. And this then alters the signals that lead to cancer growth. Nerlynx has been tested in a phase 3 trial with 2,840 women who had received trastuzumab-based treatment and have early breast cancer. In the clinical study, Nerlynx will reduce the risk of cancer, returning by 34% at 2 years for all women studied. But in a subset of women with HER2-positive breast cancer who were also hormone receptor positive, we found that they found that there was a reduced risk of 42% at 5 years in this particular patient population. So for these patients, there was a 42% reduction in the risk of recurrence at 5 years. I want to go over some important safety information. The possible side effects of Nerlynx include liver problems. The changes in liver function tests are common with Nerlynx, and your healthcare provider should do blood tests before you begin treatment monthly during the first 3 months, and then every 3 months is needed during treatment. Your healthcare provider will stop your treatment with Nerlynx if your liver test shows severe problems. Before taking Nerlynx, please do tell your healthcare provider about all your medical conditions, including if you are pregnant or plan to become pregnant. Nerlynx can harm your unborn baby. We should use effective birth control or contraception during treatment and for at least 1 month after your last dose of Nerlynx. Also, please do tell your physician if you are breastfeeding or plan to breastfeed. It is not known if Nerlynx passes into your breast milk. Do not breastfeed during treatment and for at least 1 month after your last dose of Nerlynx. So how do you take Nerlynx? Nerlynx's daily dose is 6 tablets a day, and these are 40 milligram tablets that have to be taken 1 time a day with food. You take Nerlynx for 1 year continuously, and just as a quick reminder, you should never take more than 1 dose, which includes 6 tablets in 1 day, and please do not chew, crush, or split tablets. Also, it's best to avoid foods with grapefruit in them when taking Nerlynx. Finally, as a reminder, you may be prescribed an antidiarrheal medication with Nerlynx. This is to help with the risk of diarrhea, and this can be taken for about 2 months or as prescribed by a physician. Finally, your doctor may modify your dose when you start Nerlynx and based on how well you tolerate treatment. The diarrhea is the most common side effect of taking Nerlynx and mainly occurs within the first month of treatment. To help with managing diarrhea, the doctor may start Nerlynx at a lower dose and then increase it over the course of 3 or 4 weeks to help manage diarrhea. Starting with antidiarrheal medication with the first dose of Nerlynx and continuing it during the first 2 months may also help manage the diarrhea. And then as a reminder again, your doctor or nurse may modify your dose if you do experience diarrhea on treatment. Other common side effects of Nerlynx in use alone include diarrhea, nausea, stomach pain, tiredness, vomiting, rash, dry or inflamed mouth or mouth sores, decreased appetite, muscle spasms, upset stomach, nail problems including color change, dry skin, swelling in your stomach area, nosebleed, weight loss, or urinary tract infections. These are not all the possible side effects of Nerlynx. So for more information, please do ask your healthcare provider, and do also tell your doctor if you have any side effects that bother you or don't go away. Thank you so much for your time. Thank you again, Sarah. Back to you.
Thank you so much, Deepa, for sharing that. I think it's so important as we're all kind of working through this time of COVID, that each of us have opportunities to kind of see information a lot more clearly. You know, we're managing so many things as patients, and even as the healthcare teams, we're managing so many different things in terms of communication, access, and so having the opportunity to do a little bit of a deeper dive, I think is going to be very helpful for people who are considering this therapy. So Irene, I want to move to you. You know, you're a breast medical oncologist at the University of Southern California. You know, you're seeing patients. Well, first I want to ask you, how do you feel about, you know, where we are in terms of patients with breast cancer coming into clinic safely? Where are we right now? And maybe you can speak to the experience at University of Southern California, and we can go from there.
Thanks for asking that question, Sarah. I think that's a timely question given the ongoing pandemic this year, and it's really disrupted so many parts of our lives. And it's unfortunate, put quite a bit of stress on really our patients. I mean, dealing with a breast cancer diagnosis is already a life-altering event, and all of the decisions that come with breast cancer treatment, from what type of surgery do I want, what type of medications are being recommended to me, what sort of other treatments is radiation recommended to me. You know, as a patient, you're being asked to make so many decisions that impact your future life and health, both on the side of cancer survival, but also on the side of toxicities. And that's hard to do, especially if you don't come into it with a personal or medical background. And then on top of that, we're asking patients to deal with all the stressors of COVID-19. You know, will you come in for your infusions and sit, you know, next to other patients who are also getting infusions? Will you agree to come into the clinic and be seen by a nurse, by a physician, or some other clinician and get vital signs? Will you wait in a waiting room? Or is telemedicine an acceptable option to you? And so there are all these moving parts. Not every option is available to every patient. Some offices don't do telemedicine. Some offices don't do in-person medicine. And I really feel for both patients and providers, it's a tough time to navigate the system, navigate the healthcare system.
It definitely is. Do you find that that is causing you to be much more open and transparent with patients in terms of, like, not just thinking about therapies, but also thinking about communication?
Yeah, that's a great question. I think definitely the lines of communication, we hope they've been strengthened. I think you could argue both ways, but certainly with the burgeoning of telemedicine, and we've always tried to make it, at USC, we've always tried to make it easy for patients to contact their provider, but I think now everyone is going to virtual communication much more than perhaps some of us were before. And so whether it be emails, messages through a portal, using telemedicine, there's a lot more back and forth. I do notice my message inbox does have more messages, and for the most part, that's a good thing. If we can get through and get answers to patients, and if there's less doubt and less questioning during a time when there's so much unknown, that's a good thing.
Yeah. So let's kind of get into Nerlynx and in what clinical situation or clinical situations would you be considering Nerlynx and opening the door to the dialogue with a patient about this therapy?
Well, here's where I really want to thank Deepa for setting the ground and doing that amazing presentation on what really the evidence is for benefit and really what is this special drug. I'm so grateful that we have an option like Nerlynx available to us. We didn't have this before. We didn't have, in the early stage curable setting, we did not have a small molecule inhibitor, a tyrosine kinase inhibitor that can get into the cell and prevent cancer recurrence in a different way than our monoclonal antibodies, our Herceptin and other sort of trastuzumab, these other sorts of drugs that work differently but also target HER2. So I'm glad we have that option. I always think more options is better. And in general, it appears from the data that patients who are higher risk for recurrence are really the ones who benefit. But also with that, there's an interesting interplay with Nerlynx in that it seems to take advantage of hormone receptor positive breast cancers, in that hormone receptor positive breast cancers are driven by estrogen signaling and HER2 positive breast cancers are driven by HER2. But when you have both of them together, those signaling cascades can play off each other. And so if you just block hormone receptor, which is often what we do after patients are done with their IV infusions, you're leaving the HER2 cascade wide open. And so with Nerlynx, we get an opportunity to block both of them down. And that seems to be really important because in the studies we have, in the big study we have with Nerlynx called Extenet, the hormone receptor positive patients really seem to derive the majority of the benefit from Nerlynx. But getting back to your question, Sarah, who benefits or who do I consider this for? It's really a wide range. HER2 positive disease tends to happen in younger women, and age is a risk factor for recurrence. Secondly, how big was your cancer? Really, cancers even above as small as 2 centimeters, once we get beyond 2 centimeters, the risk of recurrence seems to be higher. And then kind of one of the big things for me, at least, is node positivity. If your cancer has spread to a lymph node, that also is an indication of increased risk of recurrence. Now, there are other factors to take into account, like who is my patient, who is the person who is going to think about this drug for an extra year, what is important to them, what certain medical factors and also just lifestyle factors they have going on. And now we have the benefit of what I call pathologic complete response. And this is in the setting of, if I treated the cancer with chemotherapy before their surgery, we call that neoadjuvant therapy, then I have a measure of how much response the cancer had to the chemotherapy. And in many cases with HER2 targeted therapy and chemotherapy up front, we'll achieve what's called a pathologic complete response. And that means no cancer at the time of their surgery, which we are very hopeful for, and it's a good prognostic indicator. But a good percentage of patients don't achieve that. There is still residual cancer at the time of their surgery, and that puts them at higher risk for recurrence. And that is one of the additional areas I think about when thinking of who is an appropriate candidate or who might benefit from Nerlynx.
Thank you. Thank you. It definitely gives, I think, the listener a picture of all the different considerations that kind of go into making treatment recommendations, that it's not always just kind of like this easy, clean pathway that says if you start here, this happens, this happens, this happens, and then here's where you land. It really is so much in terms of the physician and the patient kind of explaining treatment goals, explaining what their lifestyle looks like, you know, talking about their tolerance for things, and then really kind of diving into, and I loved both you and Deepa spending time talking about, you know, not just who benefits, but then even looking deeper and say, there's even a more specific population that might benefit because of those, you know, pathways and cascades, as you were talking about. Valerie, I want to kind of talk with you because, you know, all of this stuff is data in the absence of a human being that it gets applied to. And I think, you know, as doctors and as companies talk about everything from, you know, strength of data to magnitude of side effect to hope for response, at the end of the day, all of those words apply to a human being. And so as you're, you know, maybe you can talk with us first a little bit about your journey, where you are, and then I can dive a little bit deeper into your experience with this.
Sure. Thank you for inviting me to be part of the discussion. I was diagnosed with invasive ductal carcinoma, HER2 positive only, in April 15th of 2016. So I kind of jokingly say there are worse things than taxes. And and it was a tumor that I found myself. I was pretty good about getting mammograms on a regular basis. I had had a mammogram that year in January. And so you fast forward a few months later, and at the mammogram, they did an ultrasound, and they did 3D imaging, and they kind of gave me all clear, see in a year, thumbs up. But a couple months later, I was doing a tricep stretch, and I found what felt like a golf ball in my right armpit. And so the next day, I was into my doctor to get, you know, what is this? And by the end of the week, I had the diagnosis that it was breast cancer. So it was a 4-centimeter tumor in my right armpit connected to a 2-centimeter tumor in my breast. So I underwent the neoadjuvant therapy with Herceptin, Perjeta, Taxotere, and carboplatin for 6 treatments. And then I opted for bilateral mastectomies because there were, even though the cancer was found in the right breast, there were some suspicious areas in the left breast, and I just knew I don't want to go through this again. I was told that lumpectomy was an option, but I was just like, take them. If I don't want to have to go through it if I don't have to. And then I followed up with radiation because of the lymph node involvement, and in the year of Herceptin infusions. So my treatment really wrapped up about May of 2017. And at that point in time, Nerlynx had not been approved by the FDA. It was approved in July of 2017. So between May and July, I had conversations with my oncologist about, okay, I've made it through all of that. Now, how do I keep this from ever coming back? What do I do now? What are my options? And you know, what I was told that my options were is to maintain a healthy weight, exercise, pay attention to my nutrition, limit my consumption of alcohol, and don't smoke. And those were all things that I was doing when I got cancer. Mm-hmm. So it was really scary. And that was really, for me, the physical healing had kind of completed, but the emotional healing really had begun. And so that fear of recurrence is a really big deal. So in July of 2017, I was stumbling through a Facebook page of one of my support groups, and a post appeared that was Nerlynx, newly released by the FDA. I was very excited, and so I couldn't wait to go talk to my oncologist about it. And I said, hey, I found this. Do you know about it? I want to get started. And my doctor was like, no. She's like, have you heard about the diarrhea? And she's like, I just don't want to deal with that diarrhea. I just don't want to put you through that. I kind of chuckled, and I thought, you've seen me through chemotherapy.
Right.
I am not afraid of diarrhea. Like, bring it on. If it's going to lower my risk of recurrence in any way, shape, or form, I want to give it a try. And so after some conversation with her, and kind of, we had 2 visits, and she was just kind of like, nope, don't want to do it. I made a really tough decision to get a second opinion. And that was hard because she had seen me through my worst days. But I'm glad I got the second opinion. The second doctor said, let's give it a try. You know, I think this could be a benefit to you. And probably by August, I was on Nerlynx and started my year journey.
Yeah. Well, first of all, I want to say thank you for sharing your story. It's so, you know, not just is it brave for you to share your story, but it helps so many people along the way, living with, beyond, you know, so much of what you have said kind of just screams advocacy, starting from you having regular screenings. So many of us, especially now, you know, we're all pushing right now, stop medical distancing. It's like, get back to screening. If you're listening right now and you've put off a mammogram, a pap smear, a colonoscopy, get back to screening. Pick up the phone and call. It's safe enough to do that. Because the risk versus benefit right now from not doing that isn't good. So, you know, from you being your own advocate in terms of having those regular screenings, and then when you found something, you know, we all know our bodies better than anybody else. So when you found something to be able to say that doesn't feel right, even though, you know, I just had the all clear a couple of months ago, I need to get in right away, and you did. And then even making the difficult choice of the bilateral mastectomy. I mean, it's a personal choice. You know, there's no right or wrong with anyone. It's very much about what your comfort level is and what your treatment goals are. And then, you know, just addressing fear and emotional healing, which I think is so underestimated, especially when you're thinking about the provider or the physician-patient relationship. Physicians are so, I mean, it is their job to heal. And it's like, heal means cancer-free. Heal means that, you know, complete response. And it's almost like then their well wishes go with you, but we're left, the patient is left to do all the hard work that comes after it. So I love too that you kind of brought up that, you know, emotional healing aspect. And then I really love that, you know, you heard about this treatment being available through support groups, which I also think is so underestimated. Support groups, you know, whether you're a person who loves to get in front of other people or not, you can become part of a Facebook support group, and you can never post. You can just be there and take what you need from the group and give what others need when they need it. And so even, you know, talking about the support groups all the way through to having those conversations with your doctor and then seeking that second opinion. So I want to again just commend you for being an advocate in every way. And then I want to kind of turn the conversation, Irene, just to ask you your thoughts on shared decision making. So we heard Valerie talk about, you know, Doc, I hear this is available. And, you know, Dr. Kang, I'm sure patients every day come, this is available. And whether it's, you know, an alternative therapy or something they read about or WebMD or a sister-in-law told them about something, how do you balance kind of your clinical judgment with the will or wish of the patient?
I think everyone has their own different approach. First of all, can I say, Valerie, thank you for sharing your story. That was an incredible just witness of someone's strength journey and personal just development. I think, you know, going through what you did, no one should have to go through what you did. But on top of that, just your graciousness and being able to share that experience with all of us. And especially the part where you said, hey, I think this is important for me, and then felt strongly enough about it to find a place where you could get that message heard for yourself. So thank you. And I think this is where shared decision making, I think for me and my practice, is very important. I know that I couldn't ask anyone to go through what you have to go through with a cancer diagnosis, especially with a breast cancer diagnosis. It is scary and it is hard to go through chemotherapy, even when it's strongly recommended even when you have no other choice. And even when you're 100% bought into, yes, I'm going to do everything I can to survive this cancer, it's scary. So anyway, kind of getting to the question about shared decision making, I think at the end of the day, it's somebody else's body and someone else's life that I have the privilege of helping them decide amongst their many options. Hopefully we have many options. So when someone comes to me and says, I heard about this, well, I'm all ears because I'm human too, and I can't hear about everything at once. I really acknowledge that in the herbs and botanicals and the sort of complementary therapies, I don't know as much as I wish I knew. And I think our field in general needs to know more. But one of the things I do feel is my job is everything that the FDA approves for breast cancer, it is my job to understand that therapy and be able to recommend it appropriately to patients. And yes, there is difference in styles for everybody. But at the end of the day, you know, even if I'm not gung-ho about a option, if it's been shown by the FDA to be safe and effective for a certain indication, then I think it's reasonable to talk about. I get it. When Nerlynx first came out with the XNet trial, there was no anti-diarrheal support that was at least mandated. And so we've learned since then in the medical community, we've learned how to best deliver this drug. And the answer seems to be with some sort of support and potentially with, you know, getting the dose up to a goal slowly over time. But, you know, in the beginning, I think there's a lot of questions. And so I was certainly worried too, but for patients who I've been able to walk that journey with and get through on Nerlynx, many of them have done really, really well.
That's fantastic. Deepa, I'm going to ask you, you know, the company obviously, it's an exciting drug. And for all the reasons Dr. Kang and Valerie have both shared, it meets a medical need that is necessary for patients with this kind of clinical situation. As the company developed and recognized that they had to kind of meet some of the challenges in terms of prescribing and managing side effects, I know Puma has developed an incredible supportive care program. Can you tell us just a little bit about how you approached that and then what is available for patients? Obviously, we'll also share the Puma patient assistance and patient support information as part of the webinar, but maybe you can just kind of let us into the thought process behind being able to support patients through the therapy.
Absolutely. So one of the reasons, if I may, that I love working here is this commitment that to make this as easy to the patient as possible. And I know you'll talk about copay, and I know you'll talk about other things. So in addition to the fact, you know, clearly there is often a need for prophylaxis medication, and sometimes all these medications may have a cost associated with them. So Puma does offer a voucher for up to 3 months of medication, so the patient does not have to bear the cost if the insurance does not cover it. 2 other very interesting things that we do, 3 actually, that we do have support for. So first of all, there is a call center where we have nurses. If a patient has any question and they want to talk to someone additional, we have a call center which is manned by a nurse, and it's both English and currently Spanish speaking as well. In addition, another really popular program, well, I hear about this proactively from clinicians, is a patient mentor program. So we have patients such as Valerie who have been through the program, who are then have very graciously given of their time and attention to talk to other patients who are either considering going through the program or are going through it and maybe having challenges. And then finally, we also have a texting program where patients can receive texts every day, just reminding them, take your medication, but it also comes with some fun inspirational quotes and other information on how to manage it. So we are trying to do everything we can to make it helpful and easier for the patient to take the medication and keep on it.
Thank you. And Valerie, how does that, you know, when you're a patient, I was diagnosed with an autoimmune disease at the end of last year, and it, you know, anytime you're dealing with something chronic, it's like what everything's new and medicines and side effects and just everything feels hard at the beginning. And I know through some of my own kind of support systems that came along with my biologic treatment, I don't know how I would have gotten by without having that support. Is it the same, like having that text program, having that peer-to-peer, that mentoring program? Maybe you can kind of talk with us and the listeners a little bit about how that impacted your therapy.
Sure. Yeah. When I was on Nerlynx, since I was so early on, like the mentor program had not begun yet. And so I wasn't able to participate or experience that. But I was able to benefit from the copay assistance, which I was, that just really touched my heart, that every patient, you know, at least from my perspective, is like, it was something that the pharmacy said, we want to apply for this for you. And so I knew that my personal cost for the medication was limited. And that meant a lot to me, that, you know, that was not going to be a barrier to people being able to take their medicine. And I really appreciate that about Puma. And I did take advantage of the nurse call line, because I remember having some side effects and I was curious, and I'm like, I don't even know if this is related to the medicine or not. And so I called in, and I was immediately impressed because a human being answered the call. There was no press this, press that. And I don't know if it's still that way or not, but I talked to somebody within like 2 or 3 rings, and it was really respectful, the conversation. And, you know, even though the person said, you know, I really don't know, I haven't heard of this side effect, but I'm going to, you know, take all your information down. I'm going to be passing this along. We'll reach back out to you. And so that was a really reassuring process, that what I was experiencing as a patient was heard. I did have the benefit of being connected to support groups outside of that. The Here for the Girls was a great support group for me. It's specifically for breast cancer patients under the age of 50, who are kind of navigating life in that zone with a breast cancer diagnosis. So that was very helpful. And we also have a Nerlynx Facebook page that's run by patients that is also really helpful. So when I was on Nerlynx, I found that, and that was really useful to just connect with, hey, I'm on this medicine, you're on this medicine, this is happening, is this normal, are you experiencing that? And just a lot of encouragement from other patients. It's nice to have somebody who is walking in your shoes.
Yeah, it's a reminder that you're not alone. You might feel isolated, and especially now, you know, you feel so physically isolated, socially isolated, but you're not alone. And so I think that that's really fantastic. Dr. Kang, do you find that companies that offer things like this, in terms of, you know, not just the financial side, but much more the patient support side, does it help in terms of outcomes? Does it give that ability for patients to get through therapies that might be otherwise difficult to tolerate?
Yeah, I do think that, you know, for Nerlynx at least, the data is if you stick with it for 11 months to a year, I mean, it's a long time, a year, but if you stick with it, that's where you benefit. And so these support measures to help patients both financially, with symptoms, you know, connecting patients to a resource network, I think are very important. Of course, we at your doctor's office want to be a resource too, but sometimes it's great to have a group of peers who've personally been through, you know, that same journey, or just a group dedicated to Nerlynx and symptom management and things like that. And then we really can't downplay the financial support. The cost of cancer therapy is exorbitant in this country, and so these sort of support measures speak very loudly.
Yeah, definitely. And Valerie, thank you too for pointing out that there, you know, even beyond the doctor's offices, which, you know, in our experience, the doctor's offices are always kind of that first line. You know, if you can't get straight through to the oncologist, you know, 9 out of 10 times the nurse will call you back. But, you know, you've got the supportive care resources from companies, and then you've got great, you know, ambassador programs and advocacy organizations that are started by, you know, patients that just saw a need and decided, I'm going to fill it. And then all of a sudden you've got a little family that, you know, helps you kind of walk through what Dr. Kang said at the beginning, which I think is so real. One of the most difficult things any human being is asked to do, go through, you know, the diagnosis and treatment for cancer. So thank you too for bringing out that there are external support groups also that people can tap into as they're walking through this. So we've talked about a lot of things. You know, we started, Deepa, thank you, with a nice overview of, you know, the disease itself, of the treatment, with a focus on, you know, a really positive data set that gives us hope for a patient population. And then, you know, kind of talked about clinical situations when we would consider this medicine, the patient journey in terms of, you know, the individual experience, and what support systems are in place. I'm going to just kind of go through with each one of you and ask, Deepa, I'll start with you. Is there anything we're missing, anything I'm not asking that you'd like the listener to know about reducing the risk of recurrence with Nerlynx?
Oh, no, I think if I could just step back really quickly and talk a little bit of the copay assistance. I didn't know if we were talking about that. I know Valerie mentioned that, but we do have a commitment that the patient wouldn't pay more than $10, I think, and that's something I particularly appreciate because I know how that can cause patients to make tough decisions. So I just wanted to point that out. But, you know, just chiming in and repeating what Irene said, I think, you know, patients with HER2 positive disease do have a greater risk of recurrence, and especially if they do not achieve a PCR after neoadjuvant therapy, that puts them at higher risk as well. So thank you for this.
No problem. And Deepa, a patient listening right now has the opportunity to go on the website and kind of gather all of their information to be able to bring it to their next clinic visit so that they can have this conversation with physicians. And we will definitely be able to share that information with the listening audience. Dr. Kang, anything I'm not asking that you'd want colleagues or patients to know right now?
I think we covered a lot of good things in our talk today. I just want to leave with the comment that I want patients to feel empowered, and that's part of why we're here today. Don't ever feel shy about asking a question to your doctor. Don't, just like Valerie showed us, you know, this could be really important for the rest of your life. And I learned so much from my patients, and really you only get through with these treatments if you're invested in it. So I think shared decision making has to be ground one. And I'm so glad that, you know, there is information that is readily accessible to a wide audience now.
Yes, I agree. I agree. And I think in addition to shared decision making, just kind of mapping out your goals for treatment. You know, each one of us have a different set of goals. And I think knowing up front and almost kind of setting those intentions as a team, me and my doctor, you know, saying, this is what I want, this is what I don't want. I think kind of gives the roadmap of all the different things you'll do from that moment on when considering different things. So I do also appreciate when, you know, physicians like you, Doc, are open to having those conversations and are very receptive in terms of walking along side your patient as you go forward. Valerie, anything else I'm missing that you'd like someone kind of walking this alongside you to know?
How long do we have? I could talk for a while on this, but I'll brief it up. One thing I really want to say is I really appreciate the shared decision-making approach. One of the best things my oncologist said to me was, I would rather you bother me with 1,000 questions. Actually, she didn't say bother me. I think women, we often think we're bothering our doctors. But she said, I'd rather you ask me 1,000 questions and it be absolutely nothing than to not ask me one question that is something and I should have known. And so that really freed me up. And I kind of jokingly say, okay, I'm on 782. How many more questions do I get? So I do appreciate that open approach because it means the world, because this is our life. It is. Doctors have hundreds of patients. I've got one body. And so it's really important to me to make sure that I'm doing what I need to do to not have regrets and to not look back and say, boy, I really wish I had pushed a little harder. I wish I had asked that question. And so that gave me great relief, and I'm grateful to have had this other tool to use in my recovery process. The year, I mean, it was a challenging year. The side effects, like the diarrhea, it is no joke. You know, it really isn't. It is the worst during the first 2 months, but it's manageable. And I did it in a season where there was, I didn't know about the prescription piece and all of that, or I didn't know about titrating up. So I started with 6 pills, stayed on 6 pills for the full year. I used like over-the-counter antidiarrheals, which was moderately effective, but it was worth it to me. Because in the end, when I look back, I know I did everything in my power to keep this from happening again. And so I'm not going to have regrets, whatever the outcome might be, because I've known I've done what I could. And so I just encourage patients to, within themselves, making those decisions about when you look at your journey, how do you do it to the best of your ability to not have regrets.
Yeah, I love that. I love that. I appreciate that. I think it's a takeaway for everyone, that, you know, right, especially the way we're all living right now, it's like live every day to the fullest, you know, don't leave anything on the table, make sure that you're taking care of yourself, mind, body, spirit, and be open, you know, like there's no better time than right now when all of us are connected in some virtual way. Be open, ask the questions, be, you know, as kind of transparent as you can be to get the answers you need to be your best. So I want to thank all 3 of you for giving your time. I know time's so precious right now. Deepa, thank you for what you and Puma offer for patients who really need this. Thank you, Dr. Kang, every day for putting yourself out there in a very scary environment and still delivering great breast cancer care for your patients. I know that, you know, you're saving lives every single day and just the things that you do. And Valerie, again, we thank you so much for sharing your story, sharing your heart, encouraging us, empowering all of us, giving us courage. I hope that this really meant something for the listeners today, because that's what we do it for. We want to make sure that you have everything you need to make the best decisions for you and your family and for your bodies. So we thank you so much for everybody for your time, and we look forward to a time that we can do this in person.